All right, thanks everybody. My name is Ken Paulus. I'm the founder and CEO of React Innovations. Thank you for having me. So React is an FDA-cleared neuromuscular device that can stimulate tissue up to 4 inches in depth with no skin contact required. Once engaged, the magnetic pulse depolarizes the potassium and sodium ions within the muscle cell wall. This causes the muscle to contract at a rate set by the system. The contraction is 100% involuntary and is totally neuromuscular, and we're proven to create new neural pathways between the brain and the muscle grouping, creating long-term lasting effects for rehabilitation patients. Let's see, next slide. Here we go. On the left side, you see here, we have two products. The one on the left is our React table. The patient is lying on the table. There's a wand and a magnet that can be moved on the X and Y axes, basically from head to toe, no skin contact whatsoever. On the right side, you see Pelvic Wave. This is our chair. It's a static magnet. Patients sit in there and we cure urinary incontinence as well as other pelvic floor disorders. See a delay here and a little bit of a lag in the movement there. I don't know why it's not moving.
All right.
Okay, our primary markets are physical therapy and athletics for React. We work in muscle and nerve therapy as well as pain management. Pelvic Wave side, it's urinary incontinence, sexual performance, and pelvic floor dysfunction. Our business model is to sell equipment to clinicians and athletic professionals. We negotiate territory licenses from master distributors. We charge annual fees within those territory licenses. Slide. We're going to play a video here real quick, kind of show you how it works.
React is the gold standard for neuromuscular therapy. When React is activated, the bioelectric magnetic pulse depolarizes the potassium and sodium ions within the muscle cell wall. This in turn triggers a response from the motor cortex of the brain to fire or contract the muscle. This contraction is 100% involuntary from the patient's perspective. Stimulation can reach up to 4 inches in depth and requires no skin contact. The depth, rate, and location of the therapy is controlled by the trained operator of the React system. React, it is FDA cleared and requires no skin contact. Patients are
Great. So since September 2018, React went from 0 to over $1 million in sales in 16 months. We have 26 locations in multiple states as well as the Caribbean. Key customers in the NFL, NHL, Big Ten, ACC, SEC. A proven business model with both insurance as well as cash pay practices in PT, Chiro, and Med Spa. And before COVID-19, we were trending at around $250,000 to $400,000 per month, really kicking off this summer. Post-COVID, all athletic training meetings have been canceled. We had 10 installations at regular clinics that have been canceled. So our future forecasted revenue basically is zero. Next slide, Juan. So our new adjunct market is really in the pulmonary physical therapy space. We actually have 3 clinical studies that prove our technology is efficacious in working in stimulating muscle contraction for patients with lung damage. And so those are cited in European journals, King's College, as well as the VA. Let's go to the next slide, Juan. I'm going to play this video for you as well. This is in our clinic in Matthews.
You see here, this magnet is controlled by a wand, so we can move this wand back and forth, left and right. Right now, we're here on Dr. Farman, and you can see that this is a completely involuntary contraction that we have going on with him. So, Dr. Farman, how do you feel about this right now? What are you experiencing?
Involuntary, intense contraction of my diaphragm and muscles in the back. Kind of hard to talk.
Hard to talk because we're actually
go to the next slide, Juan.
Getting him to cough power.
All right, so as we all know, in the COVID situation is pretty fluid, but there's a couple things that really need to kind of point out here. Low-end estimates of U.S. infections are talking about 70 million people infected. And these numbers down here, if you look at 4.5 million hospitalized, 574,000 admitted to the ICU, those are the folks that are going to come out of this situation with significant lung damage. And there's no way that the country is prepared with enough therapists to actually do this type of rehab. On the high-end side, when you look down here, we're looking at 12.5 million are going to be hospitalized, 1.5 million to the ICU. Again, huge numbers that current therapists are not prepared for. So we'll go to the next slide again. So our post-COVID plan is really to position React. We are already FDA cleared. We're already safe to use on COVID patients. What we really need is access to key pulmonary key opinion leaders, to determine the full efficacy and protocols for post-COVID lung damage. We have partners in Team Rehab. They've been fantastic to work with. They've got 100 clinics in 6 states. We also are working and reached out to Atrium Health, Duke Health, UNC, University of Michigan, Henry Ford, and Beaumont. Our plan right now is to design a product that fits on an existing hospital bed that patients can sit at the proper angle. We're seeking funding through the SBA grants and other private investors to advance the technology. And 100% of, if we were to win this competition, 100% of the funding would go towards the development of that next form factor product, specifically for pulmonary patients.
All right. Thanks, Ken. Big silent Zoom applause for you there. And let's make sure that all the panelists are unmuted. And Angel, let's go ahead and start with you.
Great. Well, this is, I love your system just for a variety of physical therapy, and congrats on all the success that you've already had with this. How do you plan to get into the hospitals and do the physical therapy with the speed that's needed? What's the plan for that?
That's the biggest hurdle right now for us in many ways. You know, it's a lot of the folks who are specialized in this particular area, as you can imagine, they're in emergency mode right now. And so bringing a new technology to them that has not necessarily been in their bailiwick or their knowledge zone is a bit challenging. Part of what we're trying to do is leverage the relationships that we have, finding those key opinion leaders at key institutions, and really getting them to take a little bit of time to see what our technology can do and how it can benefit them. You know, we know we're safe to use. We know we're effective. Those 3 clinical studies that were performed were on spinal cord patients. So when you have a spinal injury, which is basically at C3 and below, you lose the ability to contract your diaphragm and your intercostal muscles to breathe properly. We can force that from a neuromuscular perspective. That's a key indicator in terms of the rehabilitation of these patients suffering from COVID, post-COVID disease. So it's really about access to key opinion leaders and getting our technology out there. With the orders that have been canceled, we've got no less than 10 systems right now that I'm willing to give to hospital systems so that they can work on patients right now and begin to rehabilitate patients so we can save their lives or improve their lives quickly.
That's great. What is the, I know it's really a B2B model and it's more higher up with hospitals. What's your model in terms of going to doctors' offices? Is there a way to get in easier there?
Possibly, you know, the model long-term with COVID is really to partner with our therapy partners. There's going to be a lot of flux of folks coming out of ICU and into rehabilitation settings. So we're having a lot of conversations with existing customers and partners of ours that have our technology about how React can be used in a post-COVID rehabilitation program. So they're using and leveraging React as a tool for the hospitals to send referrals of those patients coming out of ICU and immediately putting them into a rehabilitation program at an existing clinic. But we're willing to do that over and over and over again. You know, we've only got 26 locations right now nationwide, so our reach in this is relatively small, especially given the volume of patients that are going to be coming out of this. Like, for example, in New York, I have no tables there. The closest one we have is in Tannersville, Pennsylvania. So we're going to need to develop relationships in those areas in order to generate those types of access to patients on our technology.
Right. Yes. I think if there's a way, yeah, for you to get this even within physical therapists or opening up your own shops, so it's great. But long-term, I mean, you have other needs for pulmonary physical therapy, even things like cystic fibrosis patients, as you mentioned, any kind of injury to the spine, but think that this could definitely be an added opportunity to your business going forward.
You know, there's a lot of atrophy that occurs in patients too by being in ventilation. So the average COVID patient is on a ventilator from 10 to 30 days. So, you know, their muscles are going to atrophy in terms of their glutes, their hamstrings, their quads. So again, because we're non-touch and it's so easy to move that magnet back and forth, we can go from someone's chest to their glute or their hamstring within 2 seconds, right? And it's very effective in terms of providing a full comprehensive rehabilitation program, not just focused on lungs.
It's great. Thanks.
Hey, Ken, this is Chris. Do you have a sense of the cost and timing to create a new form factor? Is this a radical change in the ultimate product and how it looks? And like, given the current, you know, constructs around the way the world's operating, like, do you have a sense of how long and how expensive that's going to be?
I do, and it's not long and it's not expensive. And so we have 2 form factors now, right? We have a table and we have a chair The technology, the core technology is effectively the same. So nothing changes about my controller, nothing changes about the wire harnessing or the magnets that we use. It's just the physical vessel that we put it in. And so our thoughts behind a 30-degree angle would be almost like a triangle position or a box seat, if you will, that would fit behind the patient in an elevated bed that's at 30 degrees. It's that simple. They just slide that in and then they can adjust it accordingly. And we've already begun designs on that. That's happening.
So just curious, like how far do you have a sense of what portion the 3000 like fits into that? Is that a really small piece of it? Is that a pretty substantive piece of the redesign?
It's a, if you're talking about the redesign itself and developing a prototype, it's probably 50% of the seat itself. The controller, as I mentioned before, all the other stuff is the same. It's really just creating the different form factor on the box or the back plate, if you will, that would be put into a bed.
Gotcha. Okay.
Hey Ken, Jeff here. You mentioned it kind of sounds like your sales cycle with some of these hospitals and these doctors' offices has kind of halted due to COVID. What's your sales cycle look like? What's the length of that? And can you kind of walk me through that process?
Sure. With brand new people that just get introduced to us, the sales cycle is about 120 days. Just so you know, our React table retails for $50,000. So this is not an inexpensive investment, but the model is proven out to actually generate increased outcomes, more efficiency, higher rated patient experiences, and affects the bottom line. So our clinics, for example, in chiropractic, they add about 30% revenue year to date by adding React into their overall practice. That's a huge number for an individual practice. So there's a really good rate of return on React technology, build out in insurance and cash. With our largest partner in Team Rehab, the cycle was going very, very well because we were in so many clinics. We were basically building tables and putting them in at 4, 5, 6, 7 a month, depending on the state. And so that was our path and growth. But their patient visits right now are down in some instances 70 to 80%. So they've put a whole hold on outside expenditures and until we can figure out a new way to kind of get patient flow back in there. And I think COVID's a way to be a part of that.
Excellent.
All right, thanks so
Thank you.
much. We're going to actually get to another Facebook question here. Oh, there you go, Juan. You're
Yeah,
back.
sorry. Yeah, we've got a couple questions here that came in. One is, does or will this product extend into releasing emotional trauma that's been stored in muscle locations?
Releasing muscle trauma. So the way I'm not sure I quite understand the question, but the way that React works is it engages the brain and the muscle to contract. Ultimately, from a physiological perspective, what happens is there's a tremendous amount of blood flow that goes into that muscle grouping, and we also stimulate all of those nerves at different layers. And so we actually alleviate pain and actually accelerate healing of those muscle tissues. And because we're able to generate blood flow. So in case you didn't know, blood flow is the key to life. If you can actually get blood flow going to a site, you can reduce inflammation and you can begin the healing process naturally within the body.
Awesome. Thanks, Ken. There are several other questions in the chat. If you want to go in the chat box, be sure to respond to all attendees with the question and the answer. And yeah, good luck.